Now I'll quickly try to look at next stuff, which is what just this is basics of what introduction to orthopedics. So we're just touching whatever, you know. So we're looking at what radiographic interpretation in orthopedics. Radiographic is simply orthopedics, you mostly deal with issues with the bone. Bones are buried deep. So for you to be able to confirm that there's been issue with a bone, you usually send for imaging. I don't know if you understand. So imaging seems to be one of the most important ways of confirming diagnosis in orthopedics. So this radiographic interpretation now, you're just trying to look at how can I be able to say if there's something wrong with any imaging picture that is sent for me. Okay, so just so you know, it's a systemic evaluation of X-ray images. You are trying to carefully examine the image that is before you to be able to diagnose if there's issues in the bone, if there's issues in the joint, or if there's soft tissue issues. So what are the general principles? You can check technical quality. So you make sure that what the picture that is given to you is what you ordered for. Okay, is what actually represent the condition of the patient. They are not mixed up with another patient's issue. They are coming to now come and diagnose wrongly for a different person. So the side marker, the exposure, position, then adequate views. Then for systemic approach, you have to observe a lot how the bone is aligned. Is it aligned normally or is it mal-aligned? You look at the bone density. Is the color uniform all round, or some places are looking whiter, some places are looking darker? So joint spaces, you have to now look at if it is a joint or if there's any joint along the imaging. You have to confirm that everything is actually within the same range. Cortical outline, soft tissues, and of course if it is something that has both sides, you now compare this side and this side. Do you understand? So that you see how far the difference has come. Now, common orthopedic findings in radiographs include you get to look at fractures where there's cortical breaks, deformities, abnormal angulations. You get to look at dislocation where there's loss of normal joints, congruency, shoulder dislocations. All right. Then arthropathies, all those osteoarthritis, rheumatoid arthritis, goats, pseudo goats. Okay, so these are all their characteristics. Okay, but we'll still come back and talk about imaging of this disease, imaging of this disease, imaging of this disease. So you guys don't worry. Okay, we can also deal with infections and all those septic arthritis. We are looking at all those lytic lesions, periosteal reactions, sequestrum, involucrum. That's the dead bone inside, the new bone formed out, and the rest of it. Okay, you can also observe tumors, whether they could be benign or malignant. All those congenital issues like congenital dysplasia of the hip, scoliosis, and also rickets. All of them, you can always try to look at them on the radiographs. That's basically images.